Good evening and good day, everyone. I hope you have a wonderful day and you are ready to learn a bit more on our new topic tonight. And it's good to be back with Dr. Ana Puigvert. Hi, Dr. Ana, how are you feeling tonight?
Thank you very much. Fantastic being with you.
Thank you so much for joining us once again, because I'm not sure if you had a chance to already be here last week on Wednesday, because actually Dr. Puigvert was here already and she already talked about male factor fertility, and tonight she will be talking about a different topic, but also on male fertility, and this time she will explain more. She will talk about toxins, chromatin, oxidative stress, and I'm very happy to have you back for sure. It's been an interesting session that we had last week, and I'm sure it's going to be interesting this time as well. I'm your host, Caroline, and as always, just let me remind everyone that we will start with the presentation, and afterwards, as always, it will be time for your questions. So don't hesitate. Put the questions in the chat section during the presentation or afterwards, and Dr. Ana will definitely answer them for you. And let me just also mention that Dr. Ana is an andrologist, experienced andrologist at Reproclinic, located in beautiful Barcelona. And well, I can only say that it's definitely we are very proud that Dr. Puigvert is also helping us out with this topic, because she is definitely someone that you should have a look at if you know that there are some male factors problems. She is definitely someone to ask. So don't hesitate. Okay, and yeah, let's start with the presentation then. Okay, Dr. Ana.
Perfect.
Perfect. Let's go ahead. Thank you so much.
Well, well, good night, everybody. We have almost all of us finished our job, but we must continue explaining you what's the male factor about toxin and oxidative alteration that you know that nowadays is one of the most important reasons of having infertility, male infertility. Well, we start knowing about the definition. Spermatozoa of infertile male are suggested to carry more DNA damage, and that increase the transmission of genetic disease. This is also due of oxidative stress, that is in an imbalance between the amount of reactive oxygen in species and the major cause of male infertility nowadays, and then even we can measure it. No? And who are those elements that produce this oxidative stress? They are called chemical endocrine disruptors that are estrogen-like and or anti-androgen substances that interfere in all the aspects of the reproductive and sexual hormonal mechanism in men. And it is really a great problem nowadays, because we are surrounded of all those kinds of elements that produce not only toxics in the fertility, but in the health of people. What they can do, they can imitate, replace, transmute the side hormonal control system, and they can become an antagonist of the natural function of those hormones in the target organs. That one of the most important of them are in the testicles. So they act in the hypothalamus, through different hormones, the FSH, that produce the activity of certain cells that helps to maturate the spermatogenesis. They can change it, they can imitate it, they can change the attitude, the feedback, they can do all what they want, and that is the great problem, that sometimes we even doesn't know what is happening. We only know they disorganize the normal activity of these hormones. And what do they look like? All what in our society we are surrounded produce directly or indirectly oxidative products or endocrinological products that can produce this alteration of fertility. what we are, the respiration, what we are eating, the leakage through the water, all of those kinds of things can produce these endocrine disruptors. They doesn't act sometimes directly. So they need sometimes, for example, water or different kinds of plastics that produce these kind of alterations. Here you have all the pathologies that produce the oxidative stress directly to the spermatozoa. Infection, pollution, smoking, drugs, our way, how we are living nowadays, diabetes, the quality what you are eating also affect this. They produce abnormal spermatozoa. They alter the transit through the epididymis that we have been talking last week, and they affect the prostate, and they produce then finally an infertility that we must evaluate when we have someone who has infertility. And how do they act? Through the inhalation, skin contact, direct or indirectly, how we have seen intake, can be concentrated dependent. If it is more concentrated, can be worse. It can indirectly through its metabolites and can act in a specific environment situation. I remember one kind of plastic that was used for vegetable that doesn't produce infertility or oxidative stress in men. But the metabolites in 4 degrees in the freezer can produce it. So it has been changed and removed it. Nowadays we doesn't have this kind of plastic. Each of them can act in a specific or summatory effect. If you have more than one of these substances, the summatory effect of all of them can produce this kind of situation. So they are very difficult to study, even to identify them, because we must know exactly how they can act, where they can act, and with kind of different toxics can act more severely. Then they produce alteration and decrease of the fertility capacity. I'm talking always about men, but in women also it's the same thing. Alteration of the sexual function due of the alteration of the hormones like testosterone, LH, and Leydig cells. Alteration of the sexual development in kids before growing up. Induction of cancer in male organs as testicular cancer. Alteration of all the axes of the production of hormones in the hypothalamus, pituitary, and testicular. They can do disorder of the thyroid gland and also an alteration of autoimmune system that they can alter in the sexual and reproductive male organs. The impact is terrible because they act, as you see here, in all those hormones that produce or participate in the production of the spermatozoa. In the testicular histology, it's the image what we can see inside the testicle. It produces an impairment of testicular evolution. They stop the growing of the testicular tissue. They make an induction of tissue necrosis. They kill the spermatozoa before being the spermatozoa. Leydig cell block that will not recognize LH and prolactin hormone, so they will doesn't act, they will doesn't produce testosterone. They change the morphology of the seminous tubules that where we have the stem cells of the spermatozoid to become a mature spermatozoa. They alter the germ cells during the division of the chromosomes. They increase the percentage of tubule without spermatogenesis, so we will have lower quantity of spermatozoa, and there's different types of maturation of the spermatozoa. And even they change the seminal fluid that is produced in the prostate. Here you can have a normal tubule, semilus tubule, where you see the sperms, the mature spermatozoa, spermatid, and here you have the Sertoli cells that helps to mature this these stem cells to becoming sperms. And here you have those different alterations that we have seen before, as a high percentage of tubule of spermatid phase that can block. So we don't have, as you can see here, any kind of spermatozoa, as you can look here. Here it doesn't have certainly cells, even no Leydig cells, that then these men doesn't produce enough testosterone to maintain their sexual habits or reproductive style. And who is exposed? Every one of all the kind are exposed to have the intoxication of this kind of products. From the embryo, the evolution of the embryo before the birth, that's terrible. We are not protected. But the most important victim are the testicles of men. The testicles are acting as a target organ where this disruptor of endocrine have the best affinity, because it's very, very protected. Testicle, as you know, is very protected. So they can act directly. They have a very, very straight relationship between testicle and toxins. And we have seen already, they act in all those areas, in the testicle, in the seminary tubule, in the development of the stem cells until the mature sperm, in all the deviation of spermatogenesis, so they can produce different types of mutations, and the quality of the spermatozoa. They can change the quantity, the movement, the motility, and the morphology of these spermatozoa. So it's very difficult to detect where they are. Already in 1918, World Organization Health determined that reproductive toxicology as a very important specialty, because every year we have more than 30,000 new products that can become in the future as a toxic for fertile people. And this is terrible, because almost all those kind of studies, they look for different types of toxicity, but there are very low studies to protect the fertility of human being. One of the persons that have worked a lot about it is Laura Waldenberg from Australia. And look what she says, not already in 2017. Early life exposure to chemical and chemical mixture can predispose individual to disease that manifests later in life. In the embryo, and when you are an adult, you can have those alterations already. How low doses of chemical during critical windows of development, like in embryos or just before becoming a baby, can alter gene expression, cell differentiation, tissue organization, and subtle ways that can lead to adult disease such as cancer, obesity, or infertility. And we know one of the most important is biphenyls, that we can find it already in lacting mammary gland or in nerve cell in mice exposure, but even in women nowadays we can detect it. So, and it is really very toxic for kids. What is epigenetic? Epigenetic has been defined as today, generally as accept the study of changes in gene function that are mitotically in one of the moments of the division of the meiosis, and do not entail a change in the DNA sequence. Well, these endocrine disruptors can change it. Then it's a pathology, a very severe and difficult way how to treat it. Another thing that is really very dangerous is that even you can have transgenerational inheritance of epigenetics. What it means that the grandmother, if he has been in very straight contact of this kind of products, can transmit it to her descendants through those changes or mutations of these genes or chromosomes. These epigenetic changes produce male fertility, and now we know it. They turn the exposure of resisting female right during the period of gonadal sexual determination is produced by an anti-adrenergic compound that we can find it in sometimes in food or on different kinds of plastic, or metoclirol, that is an estrogen compound. So they act over the hormones, and this produce alteration of the spermatogenic capacity and increase the incidence of male infertility. And it can be transferred through the male germ to the nearly all males of the subsequent generations examined. And why? Because those changes of genetics alteration, the changes of the epigenetic, is transmitted directly through the spermatozoa. And they produce different types of patterns of germ lines. That is the reason that why kids can have these changes produced by their own father. The ability of an environmental factor as an endocrine interrupter to reprogram the germ is terrible, because they change directly the genetics of these persons. And what are the toxic elements that surround us? Pesticides, herbicides, heat stabilizer, chemical catalysis, polluting plastic, compounds of pharmacological product, nourishing livestock, food, preservative, diluents, compacts, cosmetic. We know we're talking about that it can be absorbed through the skin, or cleaning products. We must learn. Here you can have the different types of vegetable that can, you have a very high number of pesticides that can affect directly to human beings, like tomatoes, pears, orange, lettuce, some teas, red or green tea from China, strawberries. We have it all around us. So we must look how can we be protected of them. Eggs are one of the foods that usually have pesticide residue higher than the European Union standard. Even in June 2017, German authority in Hanover removed more than 37,000 Dutch eggs from supermarket after they found that were contaminated by fipronil. That's really terrible, because eggs is a normal food that we eat very frequently, and we get it. Fillets are a sort of plastic that also can be very dangerous, that they produce antiadrenergic, so they reduce the production of testosterone and affect the target organs as the testicle, even during the fetal development period until the puberty phase. So through all the growing of people can be affected. Nowadays they are very controlled, but we are finding the phthalates in the urine analysis. Human urinary phthalates, what I am telling, we can find those metabolites level in higher quantities in urine, even in 7 parameters as chromatin factor, sperm provider, or reproductive hormones. They act in different ways, as you've seen in the chromatin of the sperm, in the spermatozoa, or even in those hormones that helps the production of those spermatozoa. So it's really terrible, because they not only act in one way, they act in different way. So it's very important of human reproduction health, the widespread using of phthalates. It is important for the investigation to correlate them, but we know exactly that is happening nowadays. And what we can do, clinicians like andrologists and gynecologists must always attempt to identify the etiology of the possible testicular toxicity and where it is acting and what they are doing to try to change this situation. Assess the degree of risk to the patient evaluating for infertility, to know exactly until where we can do to change the situation, and initiate a plan to control and prevent exposure to other once association between occupation, toxicant, and fertility has been established. That's really very important, because we can change some of those things. And what we are doing, we include counseling for a new way of life as a prevention and treatment even in male infertility. We know to convey that it's important to know what we are using. for IVF techniques or reproduction, because sperm that are making as a transport of the chromosomes can be the horse that can introduce into the embryons those mutations. So we have a transgenerational epigenetic alteration. And we must make, nowadays, it's really very important to make evaluation of the male factor in genetic study that we can do nowadays, most of them. As the male fragmentation index in sperm, Ana Puigvert do this through a testicular biopsy, so we can see directly what is happening then, or study generalized with PGT in embryo in IVF. And what we can do, we must be informed, and we must inform. Here you have different types of information about plastic that nowadays we are using. And then you know that this one can contain bisphenol A, so don't use it, or even don't buy food that has this kind of product in his plastic. And this, another indication, if they have phylat, please don't use it. Don't drink water directly through the plastic bottles. It is better to protect it without having light directly and drink it in a normal water, crystal water. And what we can measure, even nowadays, we can measure the quantity of PVC, that is plastic, in lipid that can cause severe oligospermia. We must study, we make multiple study of genital situation in sperm, may study genetic screening and evidently genetic counseling, because sometimes we can't do anything about it. So the patient must know where is the limit and where we can, until where we can do reproduction techniques. Recommendation, I think that's the most important what we are talking about. It. Do not use plastic to heat food in the microwave. Better not use plastic for liquids. Use glass always. Try to limit fats of animal origin, because the fat of the animal origin has a very high quantity of endocrine disruptors. They are very well used as an additive in food preparation. Try to use natural cosmetic, and don't use it if you don't have enough information about it. Eat always organic fruit, vegetable without pesticides and insecticides. Save your nutrition to have better health. And what we must do, we must protect the future generation. We must be activists of our health. We are responsible for the future generation. We must be responsible for the continuity of human and its ability to reproduce correctly and in a natural way. And the scientific society will have to position themselves to protect lobbies of power. That's really very important. We must be seriously taking care, because nowadays more than 40% of people are looking to have kids, and most of them have male infertility due of toxic products that the governments must take it out from the market to protect the future generations. Because alteration in sperm quality and quantity clearly put human reproduction really at risk, as we are seeing nowadays already. The increase of incidence of oncological pathology in young people, as well as cryptorchidism, alteration of spermatogenes, and many other alterations are marking us that they must take into account professional responsibility and change of approach in infertility treatment. These are almost new studies that we are already making to detect and to know what is happening with these endocrine disrupting chemical products and how they are attacking. Really, it's an attack against the spermatozoa, and they use their own testicles as a target organ to destroy the testicle. So, as you have seen, we are investigating really a lot of things about it to try to change this terrible situation. Finally, it is a pleasure for me to share with you this time talking about the forgotten infertility factor, that's the male factor, and the toxic effects that are surrounding us.
Thank you so much for yet another amazing presentation. That's for sure. I mean, there's those little things that maybe sometimes you don't look at, but that might be very
Excuse me, I don't hear you as well now.
okay.
And
Just
now,
let us know if you can hear me now. It's okay.
yes, perfect.
Perfect. So it just needed a second, I guess, but I am right here. So once again, thank you so much for yet another brilliant presentation because those are those little things, I guess, that we tend to not look at very often, and yet they can be very troublesome for men in this case, right? So thank you so much. Indeed, this is an excellent topic, that's for sure. And thank you for explaining all the details. And well, now it is time to answer some questions, okay, Dr. Anna. So of course, let's have a look. There are some questions ready, and I see people are typing. So I guess you do find interest in that. That's really good to hear. And let's have a look at the first question. Can I ask, what would you consider normal sperm morphology for someone aiming for natural pregnancy?
Well, the World Organization has a limit of 15% of normal sperm morphology. That's enough to have a normal natural pregnancy rate. 15%. In the 19th, it was 50%. What is happening nowadays? That the quality of the sperm is going down, the seminal product is going down, and so they are adapting the situation to the normal, to the normal people who can have kids. But the truth is that we are going down and down. But nowadays we consider normal 15% of sperm morphology.
Excellent. Thank you so much indeed for that question. And yes, this is a little bit scary knowing that maybe it may change in the future.
I am losing your. I don't hear it so
You
well
cannot
now.
hear me?
Now yes, now perfectly.
Okay, so I guess just wait up like few seconds more, okay? Sometimes that might be the problem, but I'm right here, okay? So
Okay.
thank you once again, of course, for that question. And let's have a look at the next one. My husband has 77% DNA fragmentation damage and has been prescribed turmeric tablets for 3 months. How effective is antioxidant treatment in bringing down damage?
Oh, 77% is really, really high. It's really high. In the labs nowadays in Spain, they are telling that it is a pathology around 30%. That's not true. We have a lot of papers that demonstrate that with until 50% of DNA fragmentation, we consider normal, but higher than 60%, it is really very pathologic. I think that the most important thing is to detect where is the problem, why your husband has this DNA fragmentation, kind of food he eats, where he works, because some jobs you are directly in contact of toxics, even the frequency of relationships, because you must know the epididymis make a very damage of the DNA of fragmentation of spermatozoid. In this condition, I recommend people to have their sperm screening with no more than 3 days of sexual abstination. That's important. We must look if he has an infection in urine or in sperm. When you know exactly or more or less where can be the problem, you must try to change it or to treat it. And you can be helped with antioxidant treatment. Sometimes we cannot obtain good results, but I think that really it helps. It helps. I think that one of the best antioxidants for this kind of problem is having the Q10 antioxidant products are really very, very good. If you don't have any kind of natural pregnancy and your husband continue having 70% DNA fragmentation, then the best way to have a kid is making an IVF and taking the spermatozoa directly from the testicle. That are the youngest one, the best one, normally, if the endocrine disruptor are not affecting directly the testicle. That we can know it before, because when you make a medical history and physical exam, you make an exploration of the testicle, and you can know more or less if you will have any problem there. And you must make a study of spermatozoa fish. You can do a lot of things to detect exactly where is the problem.
And thank you so much, Alice, for your question. And again, Dr. Ana, for your answer to that with lots of details as well. Next question is, what is the method to test for toxicity in our bodies?
Wow, it's really very difficult because toxicity is very, very wide. Toxicity is all whatever the plastic of this table, of the top lab, can affect us. The most important thing is to live with as the most natural way of life as you can. Indirectly, if you make blood screening, you can see important changes of each of the organ, as the liver, kidneys, and there you can find impact of the toxicity in your body.
And thank you once again for yet another brilliant question. Let's have a look. Karen has added one more. You mentioned there are endocrine disruptors in animal fats. Is there also endocrine disruptors in animal meats products? As I imagine, most of them contain fats.
Sure, it's like this. More of the animal food that they eat have this endocrine disruptor. I don't know if you remember, more or less 15 years ago, it has a very great problem with the meat that were they finding estrogen-like products that they are using to grow up very quickly those animals, like a chicken. So you will find these endocrine disruptors in meat, in all kinds of products, because all of them has fats. Even they give them fat because the fat is the product that make good taste of your food. So they give them artificial fat to have better taste of this meat.
All right, again, thank you so much for that. Okay, and let's have a look. Now we will have a bit of a longer question. So my husband and I eat 99% organic food and generally quite aware of not using plastics, but our water comes in big bottles which we decanter in glass bottles. Does this make a difference? Likewise, is using silicone to cover heat foods better than cling film? How disruptive is having stainless steel and aluminium with acrylic artwork in our rooms, as I have a lot of artwork that I've designed using these materials?
I think, Angela, that you're doing it very, very well. We must eat organic food. And this is a different way of life, a different way of living. And I think that the pandemic that we are having all around the world must change in a better way of life. I hope this. And one of those things is making what you are doing. It's really important. But unfortunately, it's impossible really to change it so quickly. It's one by one we must doing. In the future, probably we'll have better houses with less toxic products, and sometimes some of them are really not toxic. But I think that normally what you are doing is quite well.
Indeed. Thank you so much, Angela, for that detailed question, and a great one for sure as well. Thank you so much indeed. Okay, let's have a look. Next question is, so what test could be carried out on the sperm when undergoing IVF?
Well, one of the most important things that you must know is that the sperm screening is only a photo finish of when a man ejaculates in that moment. You must know that from the stem cell until the spermatozoid, we need more or less 2 months and a half and 3 months. And men produce constantly through the tubules this amount of spermatozoids that are changing. So when you are undergoing IVF, first of all, we must know why you need an IVF. And if we can change something, we can try to have a natural pregnancy or a better result of this IVF. There are a lot of different types of tests, but the most important thing is go to your doctor, to your andrology, and then he will make correctly his job to know what is happening and what he can change to have better results in IVF.
Wonderful. Thank you so much for yet another advice. And let's have a look. Question is, can seminal plasma anomalies cause issues? Also, my husband's sperm morphology is 6. The range starts from 4. Is this enough?
It is enough for IVF. Less than 4, you will have trouble and difficulties to have good result with them. But the most important thing is to know why he have this morphologic alteration. He can have an infection, he can have a varicocele. Varicocele is really terrible with sperm morphology, and if he can be operated, we can have good results, even 42% of natural pregnancy. That is really very, very important. Imagine that in the United States, the health companies doesn't pay any kind of IVF if the man has a varicocele and is not operated. So you must do, and the doctor must do a physical examination, and if he detects a varicocele, he may choose what he must do. And normally he must make an operation to take out a varicocelectomy. That's really not difficult. It's only 1 hour in the operating room, and in the same day he can go back at home. He must rest 3 or 4 days, and it's enough.
All right. Once again, thank you so much for yet another interesting question. Okay, and let's have a look. Okay, one more here. If you eat organic animal products, is that also a problem?
It is less problematic because it is very, very difficult to have food, even animal products, without any kind of toxic. That we know that we must eat less meat that we are eating in the Occidental society. But it's not as a great problem because nowadays the governments are taking very well care about the control of the organic products.
Understood again. Thank you so much. And there's a thank you from Karen actually also here. Okay, so next question. Are you saying we should eliminate all animal products? I thought fat is important to make hormones.
I say that animal products have a lot of fat with a lot of toxic products, but the human, we are adapting year by year, time by time, to the new situation of the society. We are not the same that 100 years ago, that if people that was living 100, 200 years ago cannot eat what we are eating nowadays because they will get very. So we must moderate what we are eating. and we must, naturally, it's very difficult to change so quickly those things. So it is important to take really care what we must eat the best thing what we can. The problem is that organic products, animal organic products are really expensive nowadays. So only few people can eat about this kind of quality.
All right. Again, thank you so much indeed for that explanation. Okay, and now let's have a look. So when testing bacteria pathogens in sperm, does the sperm need to be alive or can you also get results on sperm that is tested a few days after the sample is produced?
Right? When testing bacteria, yes, sure, it can be alive, but you know that it must be alive. But the testing of bacteria and pathogen in sperm is a different type of sperm screening. We make a biological culture, so we detect which kind of bacteria we have or kind of pathogen we have, and with it we can make an antibiotic treatment, a specific treatment.
All right. Again, thank you so much indeed for that explanation. And let's have a look if we have more questions. I see that someone asked about recording. Yes, of course, it's possible. It will be available tomorrow. Okay, I will send you a link in a second. And in the meantime, Karen has added one more. I mean, to clarify it must be alive.
Sure. You
Okay.
can take a sample and leave it in the freezer or in your table 2 or 3 days. In the moment that you take the sample, you must bring it to the lab.
All right. Thank you so much for the clarification as well. Someone is typing, so let's give it a minute and let's have a look if we have more questions. And we will be slowly finishing. So, of course, if you haven't asked your question, now it is time to do so. And just go ahead and type this in. Let's give it a second. And as I've mentioned, the recording will be available on the site that I have just sent to you. So also on my IVF Answers, but also on our YouTube channel. So simply subscribe. That way you know when it's uploaded as well. And let's still have a minute to see the question. Okay, yeah, here it is. Okay, that's an interesting question. And actually, we got two more of those. So, what is your view or your prediction on how male fertility is going to decline and look like in the future?
Better don't tell it. Better don't tell. We have a very great problem, I think, because it is true that we are doing a lot of studies, but the problem is that nowadays people think that when if you have an IVF, it's enough to have kids, and it's not true, because the problem that we are having with this kind of endocrine disruptor are more than only infertility. That is really serious, because the population, for example, of Europe are becoming older and older because we doesn't have new kids. People are also older to have kids. So we'll have a very social, very dangerous situation because we doesn't have change of new generation. From these 30 last years, we are looking at the claim of the quality and the quality of the spermatogenesis of the sperm quality, and we are going up and up about male infertility cases because more of the people thinks that if I have one spermatozoa, it's enough to have one kid, and that it's not true. Men produce millions of spermatozoa because only very few has the fertility quality to fertilize those seeds.
All right. Thank you definitely for an interesting question. Maybe it's the answer is not as we would like, but that's the truth. Yeah, and so we just need to deal with it, I guess. Yeah, thank you so much. Okay, and let's have a look at the next question. Okay, Karen has added, yeah, in regards to the alive sperm. So one clinic provides postal service overseas, and I'm a bit worried about this, as of course the sperm wouldn't be alive.
It depends of what kind of studies he must do. If it is genetic, there is no problem. But if it is quality fertilizing test, it must be alive. I think that some of those studies must be direct. And bacterial pathogen, sure. Overseas, it's in few hours. Few hours.
Mm-hmm. Okay, so it must be alive, yes, in order
Yeah.
for to check it. Okay, thank you so much for the clarification, and of course your follow-ups, Karen, as well. Okay, let me have a look. Okay. Okay, Angela, I'll just simply, I guess, yeah, this is like a. Thank you so much, Angela, for your comments here as well. And again, someone is typing, so I just want to make sure that whether we have a question or not. But I guess we will be finishing. So before we do, Dr. Ana, anything, any final words tonight?
First of all, thank you to you who remind me to stay with you and help all the men who has infertility troubles to find a light for fertilizing and having a baby. I think that we must be really positive because nowadays more and more people are taking really seriously the possibility of testing male infertility, and this is very, very, very important. It is really very important because if you think that one spermatozoid is one kid, we'll have great problems. We are not treating spermatozoa. We are treating men who have male infertility as the same different types of specialty in medicine. We are not treating one organ, we treat a patient, and that is really important.
Excellent. Thank you so much. And before we finish, one more question. And this question, I'm sure you receive definitely lots and lots of times. What supplements could you recommend to improve sperm quality?
And in the future, if you want, we can make a one webinar like this one, talking about the different types of supplement. Uh, Personally, I think that we must choose the medication that the patient must take depending of his situation, medical situation. Supplements really are these supplements. If you have a good diet, if you have a good health, if you take care of your food and way of life, normally you will don't need any kind of supplements. You will need specific supplements depending of the situation of your sperm screening, of your medical history, of your physical exploration. Then we will choose one specific for it, but not all of them are good. Even they are useful. Some of them are really doesn't. You are throwing your money buying some of those supplements that really doesn't serve of anything.
All right. Thank you so much. And yes, I'm definitely would love to do another webinar with you on supplements. This is always something patients ask, and of course, that's obvious. Anyone would like to be able to simply improve the quality with that. So thanks so much. And we will be finishing. Dr. Ana, it's been a pleasure to have you. And of course, as you can see, some of those thank yous are for you right here. Very interesting webinar. Thank you for interesting presentation. Wise advice. Thank you, Doctor. Thank you so much. Really, as you can see, it's been very, very useful to everyone. So I'm very happy that we are still here and we are still, as you know, every single day. And I'm so very happy that you are coming here and asking questions. And yeah, that will be it for tonight. Once again, let me remind everyone that, of course, if you would like to get in touch with Dr. Ana or anyone, the team from Reproclinic in Barcelona, feel free to do so. I am sure they will be more than happy to help you out. And well, I can only add best of luck to everyone. And of course, Dr. Ana, again, thanks a lot for joining. I do hope to see you quite soon, I hope as well. And of course, take care, everyone. Okay. Thank you so much and have a lovely evening. And I hope to see you tomorrow. We will be here, of course, at 8 p.m. UK time. So just sign up if you haven't already. Thank you, Dr. Ana. Thank you, everyone.
Nice to meet you. Hope see you soon. Thank
Thank
you to
you.
you, all
Take
of
care.
you.
Bye.
Bye.